what gets measured gets improvement. What doesn't get measured, we're not sure how we're improving. If recovering from pelvic floor dysfunction can take months, sometimes even years, we want to measure our progress along the way as we're working. So what I have here is the Prometheus device, which is a pelvic floor biofeedback and EMG machine, and this records voluntary muscle contraction. Now we can use this with different electrodes on various other muscle groups, but what we have here is a specialized probe that helps us insert directly into the pelvic floor so that we can measure the muscle strength, the muscle activity, and also the ability to relax the muscle of the pelvic floor. So in the clinic, how we do this, so this model we have here, you just cut away, and everything you see that's red is skeletal muscle tissue, and it consists of the pelvic floor. So we insert the rectum into the rectum with this device, with sterile medical lubricant, gently into the area, and then once we are comfortably in the area, we can create a test for our pelvic floor muscle strength. And so how we do this is we ask the patient, can you contract your pelvic floor? How long can you hold it? And so if you see on this readout that when we're at rest, there's very little muscle contraction. And normal pelvic floor tone is about 1 milliamp. And oftentimes men that come in with chronic prostatitis diagnosis or chronic pelvic pain, they oftentimes have pelvic floor muscle tone that is 4 or 5 times higher than normal. And so, for instance, in my own journey of overcoming pelvic pain, when I started pelvic floor therapy with my PT, she measured my resting tone as 16. So what that would be like is the amount of force that it takes to create about 16 milliamps is like a gripped fist. And over time, over the course of therapy, we brought that resting tone down to 1 to 4. And so when we're performing this treatment, we retest about every month or so to make sure that we are strengthening the pelvic floor in the ways we want, but yet also the resting tone is coming down as well. And this is also a good opportunity for men to exercise the pelvic floor in the correct ways, because sometimes if we think we're doing Kegels correctly, however, we're bearing down or we're not able to return the muscle activity to baseline or to, let's say, nice resting tone, that's an opportunity to improve how we're working hard. When we're trying to work hard, we really want to strengthen the muscle, but yet during the rest of our day, we're trying to find that nice even tone that helps us support the pelvis when we're lifting weights, when we're doing work around the house, let's say. But then more often than not, we should have a nice resting tone. And so this is another specialized piece of equipment that I've brought into the practice that I would recommend that if you're out there seeking help, seek out a physical therapist that has some of this specialized equipment to measure your baseline of where you start and to quantify which tissues are dysfunctional and how dysfunctional they are when you start, and then helping you track progress and ensuring that you're performing the exercises for the pelvic floor correctly so that you recover from your pelvic floor dysfunction as quickly and directly as possible. Thank you.